Hello world, my name is Janice Benefiel, and this is a video informational on clean intermittent catheterization, also known as CIC, for both males and females. Now let's get into what the presentation is all about. It's going to contain the following: defining features and characteristics of the medical procedure, the impact of the procedure, the role the teacher plays within the school system, specialized training needed for the procedure, educational implications, and resources for parents, such as support groups, organizations, websites, and so much more. So now let's jump right into the what, the who, the why, and the how of CIC. The what? CIC is a medical procedure in which a tool is used to empty out the bladder, whether that's for a bowel movement or regular urination. The who? This is for people with various medical conditions such as stroke, multiple sclerosis, spinal cord injuries, cerebral palsy, or any other medical conditions that leads to my why. Conditions where patients need either short-term catheter-based management or urinary bladder assistance for a daily habit of life. And the how. CIC can be done by the patient or the caregiver. But now we need to dig a little bit deeper into CIC. Defining features and characteristics of CIC. The medical procedure involves the passing of a specialized tube called a catheter down the urethra and into the bladder. The urethra is the channel used by males and by females to urinate down. Intermittent catheterization allows urine to drain freely and the bladder to be emptied, in which the tube is then removed. A catheter can be used for 2 to 4 weeks and should be replaced before it becomes discolored, hard, or broken. Let's move right along to the steps for CIC. The steps are slightly different for both male and for female. In the beginning, both male and female should wash their hands with soap and water, as well as their genital area. This stops infections such as a urinary tract infection. They should take the catheter out of the package and put a large amount of lubrication over the catheter. Petroleum-based lubricants aren't up for use. For females, they should sit down or stand, whichever is comfortable, spread their legs, and with one hand spread the labia or the lips of their vaginal area. Locate the urinary opening, and then the urine comes out. They can also use a mirror to help them with this process. While the males are to sit on the toilet, spread their legs, and hold their penis in a horizontal position. This, guys, will make the urine or the bowel movement come out very easily and comfortable. It might be something that's a little bit uncomfortable at first, but as they continue to use it, it becomes so much easier. After that, the steps are the same. They should wash the catheter as well as their hands and their genital area. This helps, like I said before, for clean usage. Since emptying the bladder is so important, you can only imagine the impact CIC has. It provides a student with the avenue of convenience, helping them to build their self-esteem and use the bathroom independently. Successful, clean, intermittent catheterization depends on the ability of the child, parents that undertake the procedure, and the effective integration in both the home and the school. Within the school system, there isn't a huge role the teacher plays when assisting a student with the need for a CIC procedure. The school nurse assists the student who may need that CIC assistance in the school setting and supports the importance of correct technique for the student at home and at school by their family or anybody caring for that student. I definitely wanted to include the advantages and the disadvantages. The advantages of CIC is it mimics the normal bladder pattern when filling it up as well as emptying it out. There is no permanent catheter left in the bladder, and there is a lower risk of infection when using it correctly. However, with advantages comes disadvantages. One would need to manage their fluid intake, such as alcohol and caffeine. They also need to watch out for that CIC can be time consuming in the beginning, but the more they do it, the more they practice, the better they will get. When addressing specialized training can be given to staff on a voluntary basis. There is no contract obligation for teachers or non teaching staff to manage a student that needs CIC assistance. However, case managers of these students are usually trained. Developing a local policy for CIC is essential with this process. It comes down to the anxiety of the parents, the school, the staff, and any health professionals involved with this student. Staff must be taught the effective techniques of the school, and they should be ensured that they're going to wash their hands with soap and water, be provided with sterilized gloves, and the employer is responsible for protective equipment and waste disposal facilities for the student. With educational implications, teacher and the IEP team as a whole should choose the following continence management program at the school. They should all have the same goal in mind: negotiating and planning, delivering evidence based training for the child, gaining urinary continence, allowing students to be independent, and making each member familiar with all of the policies involved. I truly hope you enjoy my presentation on clean intermittent catheterization for males and females. I provided resources for the parents, as you can see on your screen, as well as my references of where I gathered the information. This information will be in the pamphlet as well.